Welcome to This Week in Plastic Surgery. This week we're covering 10 notable papers spanning innovations in complex reconstruction, nuances in breast surgery, a major practice-changing trial in burn care, and the impact of new technologies from AI to GLP-1 agonists. Let's dive in. We begin with two papers that address major topics in clinical practice: a definitive trial on a common burn unit therapy and an emerging concern in aesthetic surgery. In a major publication in JAMA, the Victory randomized clinical trial investigated the use of high-dose intravenous vitamin C in patients with severe burns. This Phase 3 trial across 24 centers was stopped early after an interim analysis pointed towards futility and potential harm. The primary outcome, a composite of 28-day mortality and persistent organ dysfunction, occurred in about 41% of patients in the vitamin C group, compared to about 30% in the placebo group. While this difference didn't reach statistical significance, the trial was stopped because it crossed a pre-specified harm threshold. More concerning, 28-day mortality was significantly higher in the vitamin C group at 15% versus 7.6% in the placebo group, which represents nearly double the risk. The clinical bottom line here is unambiguous. High-dose intravenous vitamin C does not benefit patients with severe burn injury and may be harmful. Shifting gears to aesthetic surgery, a conceptual paper in aesthetic plastic surgery addresses the phenomenon of Ozempic face, or the rapid facial volume loss associated with GLP-1 receptor agonists. The authors propose moving beyond reactive correction with fillers and instead advocate for a preventative, anatomy-driven approach. They introduce a risk stratification model based on a patient's anatomical phenotype and a 4-phase prevention algorithm tied to the kinetics of weight loss. While this is a hypothesis-generating article without clinical data, it provides a valuable framework for clinicians to begin having proactive conversations with patients starting these medications, aiming to anticipate and mitigate facial aging changes rather than just treating them after the fact. Next, we turn to two papers that refine our approach to implant-based breast reconstruction. A systematic review and meta-analysis in Plastic and Reconstructive Surgery Global Open provides a detailed look at outcomes of using acellular dermal matrix, or ADM, in the setting of radiation. Across the analyzed studies, the pooled rate of capsular contracture was nearly 17%, with implant loss at about 11%. The analysis revealed several key factors influencing these outcomes. First, implant plane matters. Prepectoral reconstruction was associated with significantly lower rates of both capsular contracture and infection compared to submuscular approaches. Second, the timing of radiation is critical. Postoperative radiotherapy was linked to the highest rates of capsular contracture, implant loss, and reoperation, while preoperative radiation had the most favorable outcomes. Finally, ADM type made a difference, with bovine-derived matrices showing significantly lower complication rates. Also in Plastic and Reconstructive Surgery Global Open, a retrospective study tackles the common clinical dilemma of managing surgical drains with prolonged high output after tissue expander placement. The study compared outcomes based on when drains were removed. The key finding was that decisions should be guided by the volume of output, not the duration the drain has been in place. Patients who had their drains removed while output was still high, over 30 milliliters per day, had a complication rate of 55.6%, with infection being the most common issue. In contrast, patients whose drains were left in until output criteria were met had complication rates similar to controls, even if the drains remained for over a month. The message is clear. It is safer to leave a high output drain in place until the output decreases than to pull it prematurely based on a time cutoff. This week also features several reports on innovative solutions for highly complex reconstructive challenges. From Plastic and Reconstructive Surgery Global Open, a case series of 4 patients demonstrates a novel salvage technique for complex recurrent hiatal hernias using a superiorly pedicled rectus abdominis muscle flap. These patients had all undergone multiple previous failed repairs. The flap was successfully used to reinforce the repair, and at a mean follow-up of nearly 4 years, there were no hernia recurrences, and all patients reported significant symptom improvement. For another complex oncologic reconstruction, a case report in microsurgery highlights a valuable technique to prevent ischemia. During an external hemipelvectomy for a large osteosarcoma, Surgeons were faced with prolonged ischemia to the leg being used for a fillet of leg-free flap. They placed temporary carotid shunts between the external iliac and popliteal vessels, maintaining perfusion to the flap for 4 hours while the pelvic resection was completed. This damage control technique, borrowed from trauma surgery, is a simple and effective way to preserve flap viability in prolonged, complex cases. Finally, a unique case in the annals of plastic surgery describes a solution for refractory cutaneous graft-versus-host disease, or CGVHD. A pediatric patient who had received a bone marrow transplant from his mother developed severe skin breakdown from CGVHD that was unresponsive to treatment. The team successfully used a split-thickness skin allograft harvested from the mother's paniculectomy specimen to cover the wounds. Leveraging the immunologic tolerance already established by the bone marrow transplant, the maternal skin graft was accepted and led to wound resolution, offering a viable option for a devastating problem. Finally, we'll look at 3 papers exploring emerging technologies in diagnostics and therapeutics. In aesthetic plastic surgery, a retrospective study evaluated a large language model, DeepSeek, for psychological risk assessment in aesthetic patients. The AI analyzed preoperative questionnaires from over 1,800 patients and generated risk scores. These scores showed a strong correlation with assessments made by 3 blinded plastic surgeons. More importantly, the AI-generated scores were significantly higher in patients who were later found to have body dysmorphic disorder or who experienced postoperative disputes. The findings suggest that AI could serve as an efficient and effective screening tool to help surgeons identify high-risk patients for more detailed psychological evaluation. In the realm of regenerative medicine, a case report from Plastic and Reconstructive Surgery Global Open shows the potential of adipose-derived stem cell exosomes for scar remodeling. A patient with a severe facial dermal injury and scar contracture was treated with topical application of exosomes combined with microneedling. Over 6 months, she experienced significant dermal healing with improved scar texture and pigmentation. This provides clinical evidence supporting the growing body of basic science on the regenerative potential of exosomes. Lastly, from the Journal of Reconstructive Microsurgery, a small prospective study explored a non-invasive method for early detection of chemotherapy-induced peripheral neuropathy, or CIPN. Using a pressure-specified sensory device during chemotherapy infusions, researchers were able to identify neuropathy with 80% sensitivity and 100% specificity. Critically, the device detected nerve function changes before patients became symptomatic or developed a positive Tinel sign. This could allow oncologists to modify chemotherapy doses to limit toxicity and help plastic surgeons identify candidates for nerve decompression much earlier in their disease course. If you only have time for one paper this week, make it the Victory Trial on high-dose vitamin C in burns. This large, multi-center randomized trial was stopped early for harm, showing a significant increase in mortality. It provides definitive evidence to abandon this practice and underscores the importance of high-quality trials to challenge long-held beliefs. Here are the key takeaways from this week in plastic surgery. First, stop using high-dose intravenous vitamin C for severe burn patients. The Victory trial in JAMA shows it may increase mortality. Second, in radiated implant-based breast reconstruction, consider preoperative radiation over postoperative, and prepectoral placement may reduce capsular contracture. Bovine ADMs also showed favorable complication profiles in this meta-analysis. Third, for tissue expander drains with prolonged high output, base removal on volume, less than 30 milliliters per day, not the number of days the drain has been in place, to minimize infection risk. Fourth, keep an eye on emerging technologies. AI shows promise for psychological screening in aesthetic patients, and early, non-invasive sensory testing could change the management of chemotherapy-induced neuropathy. And finally, for truly complex reconstructive challenges, think outside the box. Techniques like pedicled rectus flaps for hiatal hernias, temporary shunting and microsurgery, and donor-matched allografts for GVHD demonstrate creative solutions for desperate situations. That's your roundup for This Week in Plastic Surgery. The full transcript and references are available on the episode page in your Audio Scholar library. This is an AI-curated summary, For clinical decisions, always consult primary sources and current guidelines. See you next week. This is an automated summary generated by artificial intelligence, which can make mistakes. Always review the original source materials.